Owensboro Health is now taking steps to manage the shortage in their hospitals, pausing certain procedures. Eyewitness News' Emily Blackmar has the latest on the impact of care at the hospitals.
Our inventory is starting to dwindle down to a point where we're only getting about 40% of what we need to run at 100%.
Recent hurricanes Helene and Milton displaced families and healthcare manufacturers across the southeast. Beth Steele is the chief operating officer for Owensboro Health, and she says the storms have affected the supply chain of IV fluids made by Baxter. The North Carolina-based company produces 60% of IV fluids for the whole country.
A lot of people think of IV fluids as just the bags that hang and help patients when they're in the hospital. But those fluids are all actually compounded along with irrigation fluids for surgery and other types of medical grade sterile fluids. And so they're all done at the same plant.
Steele says this is not the first time the business has used conservation efforts, reflecting back on the COVID-19 pandemic. Now the healthcare system is doing that once again, halting elective procedures and those that use a great deal of fluids.
We can change certain things over so that people can take medications by mouth instead of intravenously. We can change some of our processes that are still very safe and still able to do it. So we've been doing that for the last couple weeks since the storm affected this.
Memorial Hospital and Healthcare Center in Jasper is also feeling the pinch from the IV shortage. The hospital posted on Facebook saying it is implementing proactive conservation efforts, but there are no disruptions at this time. Steele says Baxter is hoping to fix this as soon as possible.
They said it could be weeks or months. They did say by the end of this year, meaning the calendar year, that they would hope that that plant would be up to 90%. So we don't have really a lot of information.
Owensboro Health is asking officials to view this as an emergency and it will affect daily business. Steele says patients should talk with their doctors about their concerns. Emily Blackmar, Eyewitness News.